Hello, my name is Debbie and I'm a practice nurse in London. Today I'm going to be talking about the dangers of using medical jargon in healthcare. As we know, healthcare is a very complex industry already. A lot of our consultations, medicine, just everything to do with our health, from learning about the brain, the heart, the spinal cord, everything is complex. And a lot of the time, as healthcare professionals, we use abbreviations to save time and to communicate with our colleagues. In a day and age where patients actually have access to reading their notes and their medical records, it's very, very important that we, as healthcare professionals, are providing clear and accurate documentation. Even amongst healthcare professionals, sometimes a lot of our notes and the things that we write can be incomprehensible. For example, I had a patient, and this is a very common mistake, a very common error or abbreviation term that as healthcare professionals, prescribers use. She had antibiotics that she was supposed to be taking twice a day. Now, she wasn't sure if she was supposed to be taking 2 tablets twice a day, so meaning 4 in the whole day, or 2 twice a day, so 1 in the morning, 1 in the evening. And little things like that can cause, a delay in treatment, because she actually mentioned that she hadn't started taking the medication because she just wasn't sure. I had to call the doctor and just double check what, he actually meant. And it delays, it just causes delays really, which can all be avoided if there's just clear documentation. I think sometimes, like I said before, we do this to save time, but in the grand scheme of things, was time really saved? I'm having to call the doctor, wait for them to respond, just to get this information when it could have just been documented a lot clearer. And I know it's not always as black and white, and some things are just like, it just takes extra explaining, even if you write it in the same way. However, as much as we can do as healthcare professionals, we should be doing. A lot of medical jargon can cause compromise to patient safety, and not just jargon, like I said before, these abbreviations, these shortcuts. As many of you may know, in 2017, there's been an ongoing case of a nurse who gave a medication to a patient with the direction of the doctor, but the problem was that the abbreviation or the short term of these 2 medications are similar, but one is a sedative and one is a paralytic medication. Now, this is a big difference. One paralyzes and one just puts you in a sleeping state, so that if maybe your body's not coping, whatever the case may be. And to have made that mistake and given the paralytic medication, and her pin is over the line, well, her pin is gone, she's facing, I think, life or a prison sentence, I don't remember, but just little things like that where it could have been written in full, knowing fully well, what that there are, medications that have the same sort of name. Little things like that is so important that we are a lot more vigilant. And I think as healthcare professionals, we need to know what is the norm in our practice or in our work environment. If you know that you're in a place where, a lot of these medications are used, you have to be extra vigilant. Something as small as, for example, in my practice, the term PT stands for patient, whereas somewhere else, PT could mean physiotherapist, and we just say physio. So just little things like that, where I'm a lot more conscious that, because in general practice, there's a lot of abbreviations that we don't use, that the hospital use, or that the hospital use, that we don't use. So I cannot come in and say, well, in the hospital we do it like this, or we write in this way. It's not going to work. And like I said, patients have access to these notes. And so it's so crucial that we're not compromising patient safety and their health in this way, simply because we're trying to take shortcuts. I think it's very important, especially for me, when a patient is maybe under safeguarding or looked after child protection, any sort of legal, where I know that there's going to be legal intervention or my notes may be used as a legal document, I will I would over explain or I'd overwrite, simply because I don't know where my notes will end up. They're going to use that note, the patient came in on this and that day. If it's missing any information or if it's, lacking substance, that could be used against me in the court of law, and because of my shorthand or because of the medical jargons that I was using, the next person, not even healthcare professionals, non-healthcare professionals, are unable to understand what has happened in that consultation. And it might seem like a waste of time at that time to write so much, but in the long haul it will save time. So as healthcare professionals, let's do our best to find what works for us. I know a lot of the time, especially in practice nursing, typing for ages and ages and ages can be very tasking. But at the end of the day, you have to think to yourself, what is safest in this situation? What is going to, in the long run? Because everything in nursing, sometimes people aren't getting into issues over what's happened today, but it's over what has happened, years ago. And so you have to think to yourself, in the long run, are these notes going to stand?